Hello, in this video we will discuss about the serotonin syndrome. So what is the serotonin? First of all, we should need to understand. So the serotonin a chemical that carries messages between a nerve cell in the brain and the periphery. So this is the neurotransmitter, basically the happiness neurotransmitter will create the happiness, and function of the serotonin is the mood, sleep, digestion, nausea, wound healing, bone health, blood clotting, sexual desire. So this all thing is a function of the serotonin. So let's begin to understand from the brain. Brain contain a limbic system. Limbic system contain, for example, we will learn, but there is a lot of nucleus, ventral tegmental area, prefrontal cortex, and the nucleus accumbens, which that is involved for the signal. So the basically the VTA will transmit the signal to the prefrontal cortex as well as nucleus accumbens for changes the emotion. For example, it will change to convert the happiness and other things, and sleep or mood changes, digestion. So here is the blood-brain barrier. Separated the central nervous system and peripheral nervous system for serotonin. It means serotonin will not pass from the peripheral to the brain and brain to the peripheral because blood-brain barrier will not allow. So that is why the synthesis of the serotonin, if we will discuss separately in the peripheral region as well as the brain. So the low level of serotonin can lead to cause the depression, decrease the arousal, nausea, vomiting, and sadness. This is the sign and symptom of the serotonin level decrease. But the serotonin syndrome basically majorly involve for the increase the level of serotonin. So here is the central nervous system, for example, nucleus accumbens containing glial cell and this ventral tegmental area. So this is the synapse between this body. So excessive accumulation of the serotonin will occur, will lead to cause serotonin syndrome. So in this way, here is the peripheral nervous system, basically, which that's contain targeted cell, for example, muscle, gland, digestive system. So that's all, and smooth muscle. So the serotonergic neuron will interconnect, and again, after the binding, after the exocytosis of the neurotransmitter, it can be reuptake. But here you can see this the blood vessel contain endothelial cell contain also the receptor. So the vasoconstriction and high blood pressure will cause due to the increase of the serotonin. So reuptake mechanism will be inhibited by the drugs. So that is why this drug using process will lead to cause the serotonin syndrome. So here is the heart rate will also increase due to the increase of the level of the serotonin in the between the synapse and go into the blood circulatory system will target to the different blood vessel. So here sign and symptom of high level of serotonin. So the serotonin syndrome usually occur within several hours of taking drugs you're already taking. So in this way, the sign and symptom: agitation, restlessness. It means you will feel restlessness because sleep will be disrupted, insomnia, confusion, rapid heart rate and heartbeat, and dilated pupils of eye, and loss of muscle coordination, high blood pressure and muscle rigidity, heavy sweating, diarrhea, headache, shivering, and goosebumps. But this case, the life-threatening signs also. The life-threatening sign is basically the high fever, because the life-threatening sign, the high more fever due to the more temperature increase, tremor, seizures, irregular heartbeat will lead to cause heart attack and unconsciousness. So let's begin to understand this syndrome. So the drug reaction can cause this syndrome. So the what is the drug we will discuss in this time. So this is basically antidepressant. Antidepressant with a migraine medication can be caused. Dietary supplement can cause, or high level build of serotonin in body due to this drug. While the risk factors is take more than one drugs and take herbal medication and illicit drugs or other genetic and epigenetic factors, which that is a risk factor. So on the other hand, let's begin to understand the bigger picture of the synapse between the presynaptic neuron and inside is the cell. So this cell will bind the exocytosis of the serotonin will bind with the synapse with the serotonin receptor. After this binding, the channel will be open. So the serotonin containing channel will be open. After the opening, the sodium, potassium, calcium will move inside, will lead to depolarize and response. While the reuptake through this will inhibit by some drug. So let's begin to understand the drug for these causes. So how to cause from this drug? So the selective serotonin reuptake inhibitors SSRIs and serotonin and norepinephrine reuptake inhibitors um, bupropion tricyclic antidepressants, monoamine oxidase inhibitors, anti-migraine inhibitors, and painkiller. So in this way, this was the video about the serotonin syndrome. I hope you make sense about this. Please, if you like this video, please make sure to subscribe, like, and share. Ask the question for answer, and you can also give the comment below for understanding and give the positive feedback. Bye.